Hello, beautiful and amazing people. My name is Dr. David Hartwig, the owner of Atlas Health and Wellness. I'm a doctor of physical therapy. I've been in clinical orthopedics for 12 years. I have stepped outside of my comfort zone and have opened a wellness company to help serve individuals to shoulder the weight of their world, to help prevent injuries from occurring. Now, we do also treat injuries unless I believe that the injury is sufficient that you need to go through insurance, such as a rotator cuff tear or severe osteoarthritis that can't be treated conservatively. But today we're going to be discussing common injuries associated with swimming. Most swimming injuries are a result of overuse injuries. And I tried to find something that was not a physical therapy website. I try to use, PGA for golf. I try not to use the literature in physical therapy to explain the value physical therapy can offer you. But here at Atlas Health and Wellness, we do 100% free wellness exams. And that is from head to toe. We look at joint mobility, range of motion, strength, and we use awesome software to measure strength to pinpoint deficits in strength that my hands, although they are extremely skilled at determining problems, they are not able to actually give a pound or force production per muscle, joint, relationship, etc. So without further ado, let's get into it. Hopefully my recording doesn't kick me. Last time I was fighting the old recorder. Okay, so this is kind of like an overview, the introduction, talking about biomechanics and the importance of stroke mechanics, etc. Also, swimmers tend to develop injuries because in swimming, there isn't like really an off season. It's similar to dancers. I've found that a lot of individuals that are swimmers are predisposed to repetitive use injuries because they're not giving their bodies enough rest between training and they're training year round. However, most of it is related to deficits that are identifiable in a preventative way as well as a diagnostic way if there's an active inflammatory problem. All right, so swimmer's shoulder. Shoulder pain is the most frequent orthopedic injury in swimmers with a prevalence of 40 to 90% of elite swimmers. And I can attest to that. I am at Powerhouse Gyms, and they are kind enough to be offering temporary memberships for a lot of the colleges. And I have seen tons of kinesio tape on those shoulders. Oh, my goodness. A lot of these things are preventable if you get ahead of them. So if you're a coach out there, and you're in the Stewart area and you want to make sure your swimmers are not only safe, but can compete well above what the competition has to offer, you need to make your wellness evaluation for all your athletes as soon as possible because training starts today. Anyway, so swimmer shoulders usually present as subacromial impingement involving the rotator cuff biceps tendon and subacromial bursa. And this is usually the result of scapulothoracic weakness, weakness of the serratus anterior, weakness of the middle trapezius fibers and lower trapezius fibers that helps hold the shoulder blade to the thoracic cage or the thoracic rib cage. And when that is weak or is fatigued, it pops up and the humeral head becomes unstable, leading to impingement issues. The rotator cuff can become, the rotator cuff becomes impinged with this weakness of the scapula, and it leads to inflammation. That inflammation leads to range of motion deficits, and those range of motion deficits lead to further impingement. So what I'm talking about is a positive feedback system, okay? So it's going to get worse and then exponentially worse after the injury occurs if you don't get in front of it. All right, So this is just going through what I would evaluate on, the examination, postural impairments, strength, scapular stabilizers, rotator cuff musculature, latissimus dorsi, trapezius, the length of shoulder girdle muscles, soft tissue. So basically, but at Atlas Health and Wellness, we, instead of waiting until you're injured, we evaluate you before you even start trying to train for something or get in season so that we can reduce the likelihood that you're injured in season and that you can actually improve your performance in whatever sport you are trying to participate in. All right, swimmer's back, okay? So there's a lot of lumbosacral spondylosis that occurs in swimming, and that is because of the hip flexors typically and a weakness in the hamstrings. It's a very problematic position because when you are swimming, your back arches a lot. And if you lack the core stability to stabilize the lumbar spine, it can impinge your facet joints. The facet joints then get inflamed and result in achiness and inflammation. So let's see what they say. Causes include hyperextension of the lumbar spine during freestyle and butterfly. So as I was saying, it's a postural thing with the actual swimming technique. Poor kicking technique, stress fractures, potential cause of young swimmers, disc degeneration, facet joint derangement with older swimmers. Again, this is very similar to someone that's a runner. Runners suffer from similar problems because of the compressive nature of the spine, or the position the spine is in when people run is similar to that of a swimmer. Even though it is considered less impactful when it comes to swimming, the posture that swimming puts you in can irritate your facet joints and cause pain. Okay. It says poor flexibility of the spine, insufficient core strength. Yeah, so I've touched on all that. Swimmer's knee. Swimmer's knee is pain figures between 34 and 86% of single knee episodes, being the highest in the breaststroke. Knee pain is caused by mainly during breaststroke swimming. Repetitive stress placed on the medial knee produces pain during whip-like motions. Breaststrokes kicks is a high valgus load producing during sudden flexion and extension, adduction, and external rotation of the knees against the hydrodynamic environment, resulting in stress to the medial compartment of the knee. Agreed. This is especially true with women because if you have a larger Q angle, i.e. you have larger hips than males, you are more ligamentously lax than males, and the breaststroke is going to predispose you to those things. So there are things that you can do training-wise to help limit this if you know what they are. If you don't know what they are, and if you don't know how to train specifically for the activities you're doing, schedule your wellness evaluation with Atlas Health and Wellness, and we will help you not only reduce the likelihood of injury, but we will help improve your performance in whatever sport you so desire to participate in. Swimmer's neck. So neck pain and shoulder pain are like best buds. If you have a shoulder problem, there is not a doubt that you will develop neck problems. Okay, when there's shoulder impairments and range of motion at the glenohumeral joint, which is one of the joints in the shoulder complex, it results in hypertrophy of the scalenes, levator scapulae, upper trapezius, and that can limit spinal motion, compressing the joints, the facet joints of the cervical spine. So let's see what they say. Neck pain is mainly seen in older athletes. It may be due to facet joint arthritic changes and disc degeneration, and possibly nerve root impingement, or I'm sorry, I'm making up words, irritation. Muscle innervation and sensation to the shoulder region is predominantly derived from C5 through C6, nerve roots. If these nerve roots are irritated, degenerative changes in the neck and shoulder complaint can arise. As I mentioned, if you got a shoulder problem, you probably got a neck problem. So if you don't know how your shoulder's working well, you need to schedule an evaluation with us at Atlas Health and Wellness so we can lower the likelihood of you developing these problems. Again, all of this is avoidable if you know how to train correctly. And we have a beautiful gym here at Powerhouse, and I have all the equipment I need to help facilitate you becoming a better athlete. So give us a call at 954-932-8527. My name is Dr. David Hartwig. If you have questions, you can reach out to us at info@atlashealthandwellness.com. We will see you soon. Keep swimming.